Hello, hello, welcome to Following Science. I'm your host, Richard Parle, and today we're going to be focusing on thyroid cancer, a topic that's both important and often misunderstood. In this episode, we're going to be discussing what thyroid cancer is, its causes, symptoms, treatment options, and the latest in research and future directions. So let's get started by understanding the basics of this disease. To begin, let's understand what thyroid cancer is. The thyroid is a small butterfly-shaped gland located at the base of your neck. This gland plays a crucial role in regulating your metabolism, heart rate, and body temperature by producing hormones like thyroxine, or T4, and T3. Thyroid cancer occurs when cells in the thyroid gland mutate and grow uncontrollably, forming a tumor. Now, there are several types of thyroid cancer, each with its unique characteristics. First is the papillary thyroid cancer. This is the most common type, accounting for about 80% of all thyroid cancer cases. Now, it tends to grow slowly and often spreads to lymph nodes in the neck. Then there's follicular thyroid cancer, the second most common type, making up about 10 to 15% of cases. It's more likely to spread to distant organs, particularly the lungs and the bones. Then there's medullary thyroid cancer, which is less common and often associated with genetic syndromes. It arises from the C cells in the thyroid, which produce the hormone calcitonin. Then there's anaplastic thyroid cancer. Now, this is the most rarest and most aggressive form of thyroid cancer and accounts for less than 2% of cases. It tends to grow rapidly and it's difficult to treat. Now, in general, according to recent statistics, thyroid cancer is relatively rare compared to other types of cancers, but its incidence has been increasing over the past few decades, and it's most commonly diagnosed in women than in men, and detected at oftentimes a younger age compared to many other cancers. This trend highlights the importance of awareness and early detection in helping solve thyroid cancer. Now, let's talk about some causes and risk factors with thyroid cancer. Now, while the exact cause of thyroid cancer can't be pinpointed just yet, several factors are shown to increase risk, starting with genetic factors. Certain genetic mutations can be inherited, increasing the risk of medullary thyroid cancer, and in some cases, other types. For example, mutations in the RET gene are known to cause familial medullary thyroid cancer and multiple endocrine neoplasms type 2. Then there's environmental factors. Exposure to high levels of radiation, especially during childhood, is a significant risk factor. This can occur through radiation therapy for other conditions or environmental exposure, such as fallout from nuclear accidents. And then there's demographic factors, such as age. Well, thyroid cancer can occur at almost any age, but it's more commonly diagnosed in people between the ages of 30 and 50. Then gender. Women are 3 times more likely to develop thyroid cancer than men. This disparity may be due to hormonal differences. And then there's family history. Having a family history of thyroid cancer or other thyroid conditions can increase your risk. Specific genetic syndromes such as Cowden syndrome can also increase the risk of getting this cancer. Now, understanding risk factors can help in identifying those at higher risk and helps in implementing early screening and preventive measures that can help ensure that thyroid cancer is not at its most aggressive form or at the highest stage when you first get it checked up. Now let's discuss some symptoms and diagnosis of thyroid cancer. It's important to recognize these signs early on for better treatment outcomes. Now, some common symptoms include things such as lump in the neck, which oftentimes is the first sign of thyroid cancer. And it's basically like a lump or swelling in the neck that can be felt through the skin, and this lump may grow slowly or rapidly. Then there's changes in voice. Persistent hoarseness or other changes in your voice can occur if the cancer affects the nerves controlling the vocal cords. Then there's difficulty swallowing. As the tumor grows, it may press against the esophagus, making swallowing difficult or painful. Then there's pain in the neck and throat. Unexplained pain in the neck and throat does not always go away, and it could be a sign of thyroid cancer. Then there's swollen lymph nodes. Enlarged lymph nodes in the neck can indicate that thyroid cancer has spread. Now, some people may not experience any symptoms in the early stages, which is why it's so important to have regular checkups so that even if you can't see it visibly outside, it can still be tested and figured out, and potential risk factors can be deduced. Now, let's talk about some diagnostic procedures that people often go through when they get thyroid cancer or even before it, such as the physical exam. Now, during the physical exam, your doctor will check up for any other physical changes in your thyroid and ask for your medical history and symptoms. Then there's blood tests. These can help determine if the thyroid gland is functioning normally by measuring levels of thyroid stimulating hormone, or TSH, and thyroid hormones. Then there's imaging tests. Ultrasound is often commonly used to create images of the thyroid and detect abnormalities. Other imaging tests like CT scans or MRIs may be used to assess the extent of this disease as well. Then there's a biopsy. A fine needle aspiration biopsy involves using a thin needle to remove a small sample of thyroid tissue for examination under a microscope. Now, this is the most definite way to diagnose thyroid cancer. And in general, all of these diagnostic tools are essential for accurately identifying and staging the cancer, which guides the treatment plan. Now let's talk about some treatment options available for thyroid cancer. Treatment depends on the type and stage of the cancer, as well as the patient's overall health and preferences. Some standard treatments include things such as surgery, which is, of course, the most common treatment for thyroid cancer, and it removes part or all of the thyroid gland. The extent of surgery depends on the size, type, and spread of the tumor. And some options include things such as first, removing the entire thyroid gland, second, removing only one lobe or half of the thyroid gland, and third, radioiodine therapy, which happens after surgery, and this therapy is used to destroy any remaining thyroid tissue and cancer cells. This treatment is effective because thyroid cells naturally absorb iodine, so it actually works, this therapy. Then there's hormone therapy, which happens again after the thyroid is removed. And this is basically to replace the hormones that are necessary to perform the functions that are usually handled by the thyroid gland. So if you're removing the thyroid gland, of course, you can't make those hormones anymore. So you need to go through hormone therapy to replace those hormones to make sure that your metabolism is working properly and it prevents the recurrence of this cancer as well. Now, let's talk about some emerging treatments. Some emerging treatments include things such as targeted therapy. And these targeted therapy drugs specifically attack cancer cells by interfering with specific molecules involved in tumor growth and progression. These drugs tend to have fewer side effects than traditional chemotherapy. Then there's immunotherapy. Immunotherapy treatments boost the body's natural defenses to fight cancer. While not yet standard for thyroid cancer, research is ongoing to determine their effectiveness. Now, each treatment plan is tailored to that individual, and it's important to discuss all options with your healthcare provider to choose the best course of action, of course. And then now let's talk about living with thyroid cancer and how a lot of people manage to fit living with thyroid cancer in their daily life and create a new normal in a sense. So, first of all, they ensure that they have good nutrition because the balanced diet is crucial for overall health. And after thyroid surgery, some patients may need to adjust their diet to accommodate changes in hormone levels, which is why they eat food rich in iodine, such as seafood and dairy, which can be beneficial to them. And then exercise. Regular physical activity helps maintain overall health and well being, and it can also improve mood and reduce fatigue. And then they also focus on their mental health because dealing with cancer can be stressful, which is why it's important to seek support from mental health professionals if needed. And they also practice things such as mindfulness and meditation, which can all also help manage stress. Then they have support systems. Family and friends play a crucial role in providing emotional support, and so they don't hesitate to lean on them. Support groups, both in person and online, can also be beneficial because it connects you with people who shares their journey with you, or you share your journey with them, which can be super comforting to everybody involved in the process. Now, of course, there's also other resources that are provided by the American Cancer Society and Thyroid Cancer Survivors Association, which they use to get the valuable information and support that they need. Now, let's talk about some research and future directions that thyroid cancer is going in. So, first of all, let's talk about current research. Researchers are continuously studying thyroid cancer to better understand its causes and develop more effective treatments. Studies are exploring genetic mutations, environmental factors, and how they contribute to thyroid cancer. Now, clinical trials are investigating new drugs and treatment combinations that could offer hope for patients with advanced thyroid cancer. These trials are crucial for finding safer and more effective treatments. Now, some future innovations include things such as advances in genetic testing, which are helping to identify individuals at higher risk and thus enabling earlier intervention. Then there's such things such as personalized medicine, which tailors treatment based on the genetic profile of the patient. And it's becoming more prominent as it's so useful. And then there's also new technologies such as improved imaging techniques and minimally invasive surgical methods, which are enhancing the precision and effectiveness of treatments. Now, immunotherapy and targeted therapies are promising areas of research that could significantly improve outcomes for thyroid cancer patients. These treatments focus on boosting the body's immune response or targeting specific cancer cell mechanisms. Now, as we wrap up today's episode, I just want to thank you all for joining me on this episode of Following Signs. If you have any questions or feedback, feel free to reach out. And of course, make sure to subscribe and share this episode with anyone you think might be interested. Now, of course, stay informed, stay healthy, and see you next time. This is your host, Rutu Raparo, signing off.